Since the beginning of the pandemic, the American Medical Association has led the fight against COVID-19. As the nation copes with the effects of the crisis, we continue to offer tireless advocacy and expert resources. I'm Todd Unger, and this is AMA Moving Medicine, a podcast from the American Medical Association. This episode is part of an ongoing series featuring critical insights from the physicians and healthcare professionals on the front lines of the pandemic. In recognition of National Hispanic Heritage Month, today we're discussing the impact of COVID-19 on the Latinx community. I'm joined today by Dr. Veronica Alvarez-Galeana, Medical Director for OB/GYN Services at Community Health of South Florida in Miami. Dr. Alvarez-Galeana is an alternate delegate for the ACOG delegation to the AMA. Dr. Diana Ramos, Adjunct Associate Professor, Obstetrics and Gynecology at Keck USC School of Medicine in Los Angeles. Dr. Ramos is a delegate and co-chair for the ACOG delegation to the AMA. And Dr. Ricardo Correa, Program Director of Endocrinology Fellowship and the Diversity Director, GME, at the University of Arizona College of Medicine in Phoenix, Arizona. Dr. Correa is also a delegate of the AMA's IMG Section Governing Council. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Dr. Ramos, we're going to start with you. The Latinx community was initially one of those hit hardest by COVID-19. 7 months later, we're still seeing a disproportionate impact. Can you talk about that?
Yes, Todd. Unfortunately, the Latinx community is oftentimes in that category of employment that is considered essential workers. So we are the ones that are working in agriculture, in housekeeping, the medical assistants, and many of these jobs are not able to be done remotely. And so that's one of the contributing factors. The other contributing factor is that many of us live in multiple families in one household. I had one patient this past weekend that had 9 people living in her household. So, these are some of the things that are contributing. And the other big thing is economics. If you don't work and you're not there in person, you don't get paid. So all of these things contribute, along with the fact that there's a lot of underlying medical conditions, pre-existing medical conditions that once infected, a patient can actually have worse outcomes.
Dr. Correa?
Yes, so very important that something that we have seen besides what Dr. Ramos mentioned is that we have been having some disparities that has been underlying from the past. This is nothing new. We know that underrepresented minorities have less access to healthcare system. The only thing is that COVID just flourished that. And we are seeing that these people that have more chronic disease because they have less access to the newest medication or less access to the healthcare systems, now they are already sick and then they are getting an infection that just flourished that sickness, the inflammation that is being caused. For example, what I'm seeing in diabetes is that there is an increased insulin resistance, meaning that your insulin requirement gets so high, even in type 2 diabetes, that your insulin requirement gets so high, and then you get a lot of other complications. So besides all of the things that we have to do as a Latino community, that you have to be in the front line, you also have underlying conditions that you were not taking care of because of many other reasons of social determinant of health, and now COVID just flourished that.
That theme of COVID making everything that was already bad worse is a consistent one. Dr. Alvarez-Galeana, is this what you're seeing in your practice?
Absolutely. And I will add also that we have a lot of migrant workers in our community and patients that don't have insurance or they're green card holders. And so because of the public charge rule, they're also less likely to be coming to our clinics, requesting assistance because they are scared about the consequences of that. And so although there's been a little bit of talk about this not affecting patients who have COVID, the patients are losing trust in the system, and it really affects issues in terms of prevention of chronic diseases and the disparities that were already discussed, and then also the spread of disease.
That's a really important topic. These basically access to care issues and the barriers that have been exacerbated by COVID-19. Dr. Correa, do you have anything to add to that?
Yes, Todd, now that Dr. Alvarez mentioned about the public charge rule, this is something very important that I don't know if everybody is aware of this. And I think that the physician community and the entire community should be aware. 1 month before COVID hits the US, there was a rule that was established by this administration where people that are in the process of getting some type of permanent status in the US, if they are using any of the federal funding, Medicaid, any of the federal funding, they will be dinged. So the process cannot continue. This was a big issue at the beginning because COVID hit, and then people, of course, were afraid. Even they were sick at home, and not just because of COVID, sick because they're heart failure, dying from heart failure at home, dying from all of this. They didn't want to go to the hospital. Then there was a pause. They said, the president came and said, well, public charge rule will not affect COVID people. And okay, that was fine. August of this year, he eliminated again, and he said public charge rule is again in rule. So now we are back to zero. Nobody know this. And again, the immigrant community, and we are not talking about illegal immigrants because everybody say, illegal. No, we're talking about legal immigrants that are looking for permanent status, don't want to go to the physicians or to healthcare because they feel afraid.
I'm curious, in your practices, that's a big challenge, clearly. What do you do to inspire trust and to work through barriers that are like that? Dr. Correa, what do you think?
So one of the things is that I volunteer, and this is the main place where I see my Latino patients. I volunteer in a clinic where we did our time to undocumented immigrants, and then we really don't care if they have insurance or not. So what we are trying to do is just provide care to them. So this helped me in the sense that we are just being funded by grants, by anonymous people that want to help the community, and that's the way that we get. Sometimes we get some pharmaceutical. When the medication want to be expired, they send that to us, and that's the way that we try to survive. So in that setting, we try to do that, and we are in a safe zone where everybody knows that the clinic is there, and that the clinic is there, and then there is more trust because this clinic has been there for a long time. We have had certain incidents in this last 6 months, having some police outside the clinic. Why the police have to be outside the clinic, we don't know. So we have to call our representative that is in the Latino caucus, and they have to come and then talk to the police leaders and say something. The other incident that we have was in our testing center. There were ICE cars outside the testing center. Why ICE is outside the testing center? That has nothing to do with public health. So we also have to call. Thank God we have some very strong Latino caucus in the Congress in Arizona, and they immediately start calling their contacts, and that was destroyed. But yes, but then, even the community trusts you. Seeing this, then you have to gain the trust again. And it's something that should not happen because it's a public health problem that is not affecting only undocumented people. It will affect the entire American people. If these people get sick, the entire American people will get sick.
Dr. Alvarez-Galeana, both you and Dr. Ramos are OBGYNs. What issues are you seeing with Latinx women in particular during COVID-19?
Well, for Latinx women, everything has become more difficult, and especially for pregnant women who already are generally a population that they're isolated in the sense of, they're working, even though they're pregnant, working very hard, usually in these frontline jobs, and trying to avoid any kind of infection, especially from COVID. So these patients are feeling lonely. I've had a lot of more incidences of postpartum depression and intrapartum depression. So I've noticed that as well, especially amongst my patients who are majority Latinx patients. And they're scared to even come to the hospital. Sometimes they are asking about home births, and we have, had conversations with them about the safety precautions that we've taken in our hospitals. So that has improved over time in terms of the fear that patients have. But I believe that it's been a very isolating event for many pregnant women.
Medicine doesn't stand still, and neither do we. AMA members don't just keep up with medicine, they shape its future. Help move medicine, join the movement. Visit ama-assn.org/movingmedicine.
Dr. Ramos, anything to add to that?
Yeah, definitely. So yes, there is a lot of fear in terms of showing up and perhaps getting infected by going to their prenatal care appointments, as well as, as Dr. Galindo said, delivery, that you're going to get COVID in the hospital. The other thing to consider is that many practices are actually doing remote or telemedicine, but then this again exposes the disparities that have already been existing. And some of that is a lack of access to the internet, something as simple as that. So to be able to do a visual, a telemedicine that involves a camera, that's not always available for patients, for Hispanic patients. The other thing too is that many of those appointments tend to be phone calls when there is no internet access. And yes, there is an audio appointment, but you miss so much when you don't have the visual component. You can actually see what a patient is, what their environment is. Is it neat? Is she disheveled? Are there symptoms of depression that you can actually see clinically? So all of these things contribute to, again, continued disparities. And then the other thing too is with the children, and just reminding patients to continue the preventive care, such as immunization, especially right now for influenza, not only for themselves, but for their children. And again, that lack of trust that they're going to get infected if they go into an office, that they may acquire COVID, keeps folks away from getting that preventive care that can actually help save a life.
Well, communication is a big issue, and I think you're pointing out that, we're heading into the fall right now, where preventive care like flu shots are incredibly important. What are the ways that you all, work to improve communications and address these kind of messaging challenges that affect the Latinx population during the pandemic? Dr. Alvarez-Galeana, will you start?
Yes, so we come together as a team in our clinic, starting from the top down about communicating with patients through our marketing, we send them text messages to remind them of their appointments, and also if they're having telemedicine appointments, we can communicate through the front desk, the nurses. We all try to create a welcoming environment for the patients. We are screening everyone who comes in through the doors, so patients are aware that we are taking safety precautions to prevent the spread of COVID-19. And so just in communicating with patients and open-end communication is also very important when you're seeing a patient in the visit, to make sure that you're answering all the questions and concerns that they have.
Any other thoughts, Dr. Correa or Dr. Ramos?
So something that we have utilized is champions from the community. So it depends on the setting that you are. So when you're in a community care center where you are involved in the community, you always can find champions that are people from the community, not healthcare workers, but people from the community that are very interested in this. So we try to prepare those patients so they can spread the real facts of what is happening through their neighbors and then try spreading the things. Because at the beginning, we were having a lot of not scientific evidence. And I'm not telling about the hydrochloroquine and things like that. I'm talking about what my abuelita said, that was drinking hot tea to kill the virus. Mm-hmm. And then you get burned, and then you have to go to the ER, and it was worst. So then trying to educate the community, because in the Latino community, there is a lot of trust in the elderly, and the elderly, what they say is what you do. But no one during this generation has seen coronavirus. So there is nothing. So we have to educate those. So those champions were just going into the community and then trying to clarify. We trained them a little bit with some pamphlets, with some lectures, small, but they were the ones that were spreading also the word.
Mm-hmm. Well, that kind of work, Dr. Correa, maybe that is one of the reasons that you were recently named as one of the 100 inspiring Hispanic Latinx scientists in America. How do we do better with welcoming diversity into the scientific community, and how does diversity in the physician workforce influence the care for underserved populations?
Yeah, so I think that something that has been ongoing, this group that published this list also published a list, I think at the beginning of the year, on Black African Americans, scientists and physicians, is to make understand the entire country that science do not look only a one race or ethnicity. Science is diverse, and many people from different backgrounds are contributing to the U.S. in many things. And then bringing this among of different people from different backgrounds and demonstrating that they are making some changes in their communities, in different, in science in general, in medicine in general, that I think that can create a conscious to the community, scientific community, and to the general public, that really there's many people that are contributing here, and it's not just one group. So that is something that I think that is very important. The other part that is important is that when you think about people from diverse background, you just don't focus on, okay, these are originally from the U.S. or they immigrate from the U.S. They are in the U.S. and they want to contribute to this country. They embrace this country as their country, and they give everything that they can to this country and help the communities that they are serving. If this is an African American Black community, they will embrace, they will help that. This is a Hispanic Latino community, they will help that. And that's something that was very inspiring, seeing these two lists, and this will continue. It's not, this is the first year that they are doing this, but this will continue just to make people realize that there is a lot of people from diverse background doing a lot of things for America, and many people need to know about this.
Well, last question for the three of you for a quick round here. What, when you look at the disparities that have long been affecting the Latinx community, and you look at how COVID has exacerbated this, are there any opportunities that you see right now coming out of this situation to improve that, Dr. Ramos?
Yeah, I think COVID has exposed what we already knew, what was wrong, all the disparities. And so with that, you know that we have to step up and take into consideration population health. Because if you look at the numbers, we are going to be Hispanics, the majority, by 2050. And so the whole country's health is going to be driven by our health, whether you're here legally, illegally, and preventive health, and really trying to build up everyone's health is going to be critical, taking into consideration wherever they live, whatever their access is. And so it's an opportunity for us to come up with solutions, and more importantly, involve the community to help us identify the solutions to improve the health, not only of Hispanics, but of everyone. So it just has said, I see it as a green light to start focusing on improving the health of Hispanics as well as everyone else, because we're going to drive up the health of the country.
Well, those are important points, and I think that's a good place for us to stop for today. This concludes our COVID-19 episode, and I want to thank Dr. Alvarez Galeana, Dr. Ramos, and Dr. Correa for being here today and sharing your perspectives. We'll be back soon with another COVID-19 update. For updated resources on COVID-19, visit ama-assn.org/COVID-19. Thanks for joining us, and please take care. This content was originally published as part of AMA's COVID-19 daily video updates. Find the latest at ama-assn.org/COVID-update. I'm Todd Unger, and this is AMA Moving Medicine, a podcast from the American Medical Association. You can also subscribe to other great AMA podcasts on Apple Podcasts, Google Play, Spotify, and Stitcher, or visit ama-assn.org/podcasts. Thank you for listening.